Good afternoon, my name is Roger Ryerson. I am an EMT student out here at Shasta College. Today we're going to be going over taking a blood pressure. It's one of the important steps of taking the patient's vitals. It kind of allows you to know if the patient is going to be hypertensive or hypotensive. Sometimes when you get on scene, there's going to be something going on with the patient that you might not necessarily be able to visually see right off the bat. So by taking vitals, it kind of gives you some indications of what might be going on with the patient that you necessarily can't see. So taking that blood pressure is a huge vital portion of what we do when we get on scene of an incident. Good afternoon, sir. My name is Roger. I'm going to be taking your blood pressure today. Is that all right with you?
Yes, sir.
All right. So I got to start off by rolling up the sleeve because we want to expose the arm. We never want to do it over a piece of clothing. Roll it up to the point where his arm is good and exposed so I can get the cuff on there. Remove the cuff, get it all opened up. Finding his artery, I'm going to go ahead and wrap that around him. Get that nice and snug. So you can either leave this is your dial that kind of tells you what you're actually pumping it up to. So you can either hook it here. It's got a nice little strap that you can put it on. But if that's going to be kind of out of your line of sight, you can also place it on his shirt that you just rolled up. Or if I would like, I could ask him, sir, do you mind holding this for me? Perfect. I usually like to go with the shirt. So once it's on, I'm going to go ahead and put my stethoscope on. So with these, there's your regular adult size, and then you have your pediatric size on here. You got to make sure it's switched to the right one. How you can do that is when you toggle it over, just tap the front of it. If you hear it good and loud inside, you know it's set to the right setting. Right? Now we're going to start pumping it up. As the dial starts to go down, as you relieve the pressure, the first time you hear the heart beat through that artery, that's going to be your top number. That's your systolic number. And as it continues to go down, you're going to continue to hear the heartbeat, and then you're going to start hearing like this rushing sound. You're going to stop getting that good thump in your stethoscope. That's going to be your bottom number. That's your diastolic number. So Tanner here's doing just all right. He's got a blood pressure of 126 over 82, which is almost perfect. The normal blood pressure you're going to be looking at is about 120 over 80. So after that, I would make sure I want to document that on my PCR and make sure I pass that along to any incoming resources if you're doing a transfer of care. And again, I'm Roger, and if you're interested in getting into the EMS program, Shasta College is a great place to do that, so make sure you talk to your counselor and get enrolled today.